Okay, so hi everyone. Thank you for joining us on this online sharing session. So before we start, I'll just give a brief explanation on what is the program for today. So first, we will have a special topic sharing by Dr. Fida. And the special topic today is how reducing electron can help cancer patients. So if you have any question during this talk, you can just write down and then you can ask them during the Q&A session afterwards. So after that, we will have a detailed Hello.
Yeah, we can hear you.
Yeah. Okay, all right. So wait for a while and okay. Okay, so a very good evening, everyone. Assalamualaikum and very good evening. So today my name is Dr. Nafida. So I will presenting about cancer for this week. So for those who are follow us since last week, since last month, we know already topic is a cardiovascular disease, stroke, and also asthma. So for this week, we focus more on the cancer. So why I'm choosing this week as a cancer as a topic, because you should know that maybe one of your family members or your surrounding have a cancer, but maybe not notice or maybe not alert that you having a cancer. Okay, so you should know what are the causes of cancer, what is exactly the cancer type of treatment, and how do you overcome the treatment, a side effect of the treatments due to the cancer. So for this, we more focus on the cancer. The pie chart there, the pie chart is the mainly other cancer and breast cancer. So that's why I say the cancer statistic in Malaysia is really worrying. Okay, can you imagine after another 5 years or 5 years, 10 years in the future, maybe we can say that half of the million is in Malaysia could be diagnosed with the cancer. So this is a very serious issue because of we doesn't know what is cancer is about. I'm pretty sure if they say you're going outside, you know you have a cancer or not, you can simply ask that. I'm pretty sure the answer will be like, yeah, I know I have cancer, but I don't know how to counter it, how to overcome it. Because most of the patients that coming to me, most of them, I eat healthy, I do exercise regularly, but they doesn't know what are the causes behind it. Okay, so this is just showing the statistic for the in Malaysia 2020, and this is I would like to highlight the main type of cancer is the breast cancer. You can see the ranking number 1, and you can see the number of that is the 3,503. So you can see here, this is number of deaths and this is number of new cases. So that's mean the new cases is that mean you just recently diagnosis with the breast cancer. So usually focus breast cancer mainly in the female, right? So that's why I said female more is more getting close to the cancer disease. Why? Because we have hormones imbalance due to the period, and we also love to eat as compared to the male. So that's why we are we are very keen to be the cancer itself. So that's why I say you need to know what you can eat, what you cannot eat, and how to overcome it. All right. So before we move on to more further details on the cancer itself, I will explain first what is cancer. Okay. So cancer, you can see here, I will explain you the simplest way. So cancer is uncontrolled growth of abnormal cells in the body, or simply term, you just remember as tissue growth. or extra tissue growth inside your body. So you should know everybody, every single in the world have the cancer cell itself. Okay, so whether you are triggered the cancer itself or not. So it depends on you. Okay, as you can see more further on your left side, I give the example. You can see the normal cell in the blue color. Have in size and shape because we have a cancer, tumor, we have a carcinoma and everything. So that's why we have the variation in size and shape of the cell. So you should know. And then we're moving for the type of cancer. So you know that what is cancer you have, you should know what are the type of cancer. So see, I simply mention first one. This is a, we can say, very ranking, first high ranking, which is focus more on leukemia. Okay, leukemia is a blood cancer, so mainly focus in white blood cell. So usually we should know sure most of you said okay again you are you are doing exercise regularly to taking care of this. I mean, miss it because this is from genetic. That's mean if let's say your family member have cancer, breast cancer, whatever cancer, but you should know maybe the genetic itself you can pass through your son, your daughter, your grandchildren, all that, and then you should check if let's say you have your father, mother, and maybe you have a 3 siblings. So for example, you have maybe these 2 siblings have a cancer. Okay, these 2 siblings have a cancer, and your mom have a history of cancer. So the other 2 need to check. Because this is genetic. Genetic is a passing through. It's a passing from your mother or your great-great-father. So it's passing. So before anything happen, you need to check whether you have the cancer genetic or not. Okay. So the second one is occupational risk factor. So this one I majorly focus on radioactive material, which is oil and gas, whether you are handling with the chemical substance. So that one also can be one of the causes cancer. Why? You smell it, right? You breathe in. So that's why the chemical we cannot see. We cannot see chemical outside because it's very small particular. So sorry, a very small particle. So you cannot simply see like a virus right now. We cannot see which the COVID virus or that. Same goes to the radioactive material. All right. So the next one will be lifestyle factor. This what I'm simply says is the alcohol. Actually, you got another one which is smoking. So alcohol, smoking, eat too much of fat food, fast food, because all lot of fat and all. So this is can trigger your cancer cell. Okay, and the last one, environmental exposure. So of course from radiations. Okay, these are 4 major type of causes cancer. You should know before. Before you get the cancer, this is 4 causes cancer. You should check whether your surrounding is okay or not. Okay, and the next one will be the stage of cancer. So have you heard, oh, I have a cancer stage 3, stage 2, or stage 4. So you should know what that the doctor can help you, or other treatments that you are available will help you. But you should know what stage are you. Okay, for example, right now is a stage 0. This one is starting the cell with mutation. That means because we already detect this is early stage. We just detect that you have a cancer. It's starting to grow, but not going more deeply. So you can see the picture itself, the orange part. Okay, so this is the cell is starting, just started. We call as a stage 0. And after that, we go for hyperplasia. Hyperplasia is a stage 1. So that means the tumor is starting to spread to the nearby tissue. That means this is your cancer cell. So this is your tissue. Your cancer cell is already spreading nearby. So in the stage 1, usually we cannot say simply relax, but if let's say you are diagnosed with stage 1, you can be, how to say, you can eat, how to counter it, you can eat healthy, and a few of natural treatment will help you to reduce the cancer to spread. Okay, and the next one is stage 2 and 3. So stage 2 and 3 are just simply joined together because we can say like almost this is almost the same. Why? Because it's the cancer start to grow deeply in surrounding tissue. You can see the purple color and the blue color. So this is the cancer start to spreading. So it means that the cancer maybe that already start into the bloodstream, into your blood vessel and lymph node. So by doing this, we need to be alert because by this time your immune system is very, very low. Okay, this is a very low level. We can say the level dangerous. So by boosting your immune system and eat healthy, maybe it should help you to recover. Okay, and the last one is stage 4. This is, we can say, the last stage, because the cancer is already starting to spread to the organ. So maybe if let's say okay, you have the breast cancer. Okay, for example, left breast cancer. You diagnosis breast cancer in stage 1. For stage 2 and stage 3, that means your cancer cell already spreading to lymph node, to your blood vessel. In stage 4, maybe it already affected your kidney. Okay, you can see that. Okay, it's just a breast cancer, and after that slowly goes time. You should know you need to not give up. Don't you ever give up, and please seek for any hospital or any clinic nearby or doctor seeking for help. I'm pretty sure cancer cell, you should know that we have a lot of fighting cancer. Okay, fighting with the cancer, it survive. So you should know when you have in the last stage, you should know like don't ever give up. Okay, until the stage 4. All right. So, okay, just simply didn't put the treatments. What are the treatments are available? Because the treatment of cancer, you should know already. We have chemotherapy, radiotherapy, radiation, and hormone therapy. So these all the therapy can cause such a problem like this one. You can see the side effect of the treatment. So I cannot say it's not good. We can say is that yes, it killed the bacteria, it killed the cancer cell, but it gives something else. Okay, that maybe you cannot detect, maybe you don't realize that you have this kind of effect. So that's why we can see that most of the cancer patient, after they're doing the treatment, they do not die because of cancer. They die due to the side effect. Okay, usually mainly they die due to the weak bone, infections, and anemic. Anemic is the anemic is the red blood cell is very low. So these are the side effects available after you do the chemotherapy, radiations, hormone therapy, and everything. So you should know the patient will be having a diarrhea. So you are frequently going to toilet, and that time your body will be very, very dehydrated. So if let's say you have a cancer friends or cancer survivor, you can ask them how they are frequently going to toilet due to diarrhea and frequently to urinate. So their body is very, very dehydrated. And the second one, weak bone. So you can see they are always feel pain, not so good. Even sometimes we ask them to lift the arm, also they cannot lift the arm because they have the weak bone. They cannot able to do. Okay. The third one, anemia. Anemia because it's a red blood cell is lower. So you can see the face, most of the cancer patients is like pale, not enough blood. So that's the thing. And the fourth one is fatigue. So very, very tired. And of course, the pain. The pain is, of course, if let's say, we can ask, you can interview any of cancer survivor or cancer patient. For sure, the first say they will say they are in pain. All right. And after that, after you having the pain, it will come along with the infection. So infection from infection, blood, infection from the body, the cell itself. And after that, it will slowly kill the healthy cells. Why? When we do the radiation therapy or chemotherapy, they cannot choose whether, oh, this is the good cell, or this is the bad cell, or we need to kill the bad cell only. No, radiation and chemo is majorly is going throughout all the body. So that means doesn't matter it's a good cell or bad cell, for sure they will kill. All right. The last one is skin problem. You can see their skin is a bit redness, sometimes dark color, and you got a spot because of the radiations. All right. So I'm pretty sure you are wondering, okay, now you know already what are the causes of cancer. You know already what are the treatment for the cancer and the side effect. So you should know how to counter the side effect. I mean, if let's say you know already you have a kid, you have weak bone, you have anemia and fatigue, you should know how to counter it. Okay, so we counter by reducing electron therapy. This is, we can say, is a hope also, because I cannot simply say that we are cure, we are helping you to reduce the cancer cell. No, we are helping you to reduce the side effect of the treatment from the cancer. Okay, so basically this is reducing electron therapy. So it's a biochemical reaction that giving the negative ion towards your body. So this is simply a very natural treatment, because effect in 5 main effect, which is your autonomic system function, improve your blood circulation, improve your homeostasis. So that's mean homeostasis is improve your healthy cells, okay, and increase immune system. Okay, increase immune system, your white blood cell. Remember last 2 weeks, the immune system is white blood cell itself to fight the cancer cell. Okay, this is important. And last one, proper hormone function. So for the effect of reducing electron therapy, I will highlight these 2, which is homeostasis, improve, and also increase your immune system. Okay, so I will explain 3, how does reducing electron therapy help. It has 3 points. As you can see here, the first point is increase NK cells activity. So NK cell activity is a natural killer cell. We call short form as the NK cell. So as you can see, I show one of the patient last time. You can see in 2000, before the treatment April, so NK cell activity is 8. Okay, 8% we call. After 3 months of treatment, the NK cell activity is increased, which is 43, and after 6 months, then we have 48%. So the tumor size also, you can see, slowly going decrease from the 6 become 2 m. So that's why I said reducing electron therapy is function to increase the NK cell, which is, remember just now I said it's an increase in system. NK cell is one of the type white blood cell, which is to fight the cancer cell. So mostly cancer patients have a very, very low NK cell. So that's why they cannot simply fighting the cancer cell. So this therapy will help to increase, to boost up your NK cell so that they can fight the cancer cell. All right. So this is number 2. Decrease in high C-reactive protein, which is CRP. So this is marker of inflammation, whether you're having inflammation in the body. How do you want to check? You can go for the blood test. So you can request them, can I check for my CRP? If let's say you have a high CRP, doesn't mean you have a cancer, but you should have. Yes, if let's say lower or in the, but if let's say have like about 20% and above, you need to be alert. Why? Because this inflammation can trigger your cancer cell to be active. All right, so this is what we can say. Reducing electron therapy can help to reduce the CRP. So for sure, when the inflammation is decreased, so that we can reduce the growth of cancer cell. And the last one, okay, this is prevent tumor growth. So you know tumor is a mass of tissue. Remember earlier, just how I said, cancer cell is the extra tissue. So this tumor, we want to prevent to become bigger and bigger. So you want to stop it. So this tumor cannot spread, but if it can be dangerous, because if let's say it become bigger and bigger, it can press your vital organ. For example, let's say you're having a stomach cancer. So your stomach cancer will be here, stomach cancer in here. You have stomach cancer, and nearby is a kidney. Nearby is the kidney. So if let's say your cancer tumor become bigger and bigger, it will press your kidney. So that maybe that's why you can frequently go to toilet. You cannot urine very well because they already your vital organ. So by using reducing electron therapy, you can reduce the tumor size, become smaller. Okay, so these are the three major points that reducing electron therapy can help most of the cancer patients. All right, so as a conclusion, okay, so reducing electron therapy can help to reduce the side effect of cancer treatment, increase your NK cell to kill the cancer cell and prevent the tumor growth. So you should know whatever you eat, whatever food you eat, whatever you do, your surrounding, you should know which one you can do, which one you cannot do. Because we cannot, again, we cannot see where is the virus coming, where is the cancer cell, is it be triggered or not. You should know your body itself. So that's why I say it's very, very important. If you say once a year, you do your blood checkup. We can say it's a compulsory. Doesn't matter any age, but please check. Because you know, right, prevention is better than cure. So at least if let's say for this year you diagnosis with the early stage of cancer, that's good because you can control. I mean, like you can control by you can reduce your food intake. Maybe you can seeking for another treatment to prevent the tumor become bigger and bigger. All right. So that's why I said prevention is better than cure. You should know about that. And then I just want to highlight reducing electrotherapy have no side effect and it promotes natural healings and we treat the root and not the symptom. All right, so that's it, and this is our emails and also our hotline number. If you want to know more about these treatments or how the cancer, how you want to counter it, you want to be consult with me, please contact this number or email to them. And that's it. All right, thank you so much for your listening. So I open for any questions. Any questions you want to ask, I can simply ask right now. So any questions?
Hi, Dr. No Farida.
Hello, yes, Mr. James, is it? Mr. James, is it?
Yes.
All right, okay.
I got a question here.
Okay, okay.
Okay, the reduction electron treatment.
Okay.
You say you do to so-called generate more NK cell and to kill the cancer cell and prevent tumor, right?
All right, okay.
So I mean, while you are using this reduction electron treatment, are you doing? Are you monitoring through certain measurement to gauge the improvement?
You mean how to measure the NK cell? Is it?
I know. I mean, while a patient go through this treatment, but how you justify the improvement? I'm sure you justify through the NK cell volume and also tumor growth. How you justify that?
Okay, usually in our side, in our we can say our small center, we can say. So we always do, if let's say, okay, for example, we have a lot of cancer patient coming in our side. So usually we compare before blood test and after blood test. So usually before they come into our place, before they are admitted, ask them bring your blood test before, and after these 2 weeks or 3 weeks of treatment, we will do the comparison between the blood test before and after. So from there, we can request which one you want to focus more. Maybe, okay, just now remember I said the CRP. We can measure from that CRP, the inflammation marker, and also you can see the changes of the skin. Usually the cancer patient, they doesn't have any energy. Sometimes they are coming to us they are walking very slowly, but after the treatment, you can see they are quite have energy a bit to move. You can see by yourself. If they say they want is from physically, you can see they are moving, have energy, and have appetite. they have appetite to eat more. Usually, you know, right, cancer patient doesn't have any appetite, they doesn't want to eat. But after this treatment, after we cannot say like, I give you 1 month, you for sure you can, okay, no. It depends on your body, whether your body can accept this treatment or not. So usually we always do some video to show that these are how you progress. So this is your first day of treatment. This is your last day of treatment. Usually we do the blood test form, and then we do by a comparison by physical. Okay, does I answer your question, Mr. James?
Oh yes, I'm focusing on the monitoring for improvement in the sense that normally what's a specific time frame for effective monitoring, means every month basis or every kind of day basis.
Oh, all right. Okay, so in terms of the how to say, we in terms of the, okay, the comparison. Okay, usually we do the test is, okay, we have 2 type of blood tests, which is first a simple blood test, second is a full blood test. So simple blood test usually we take 3 days once. Okay, 3 days once. So we want to see that one is a simple blood test, just a prick here, and then we show on the microscope. We choose which blood you are okay, which blood you are not okay. That one 3 days once. And the major, which is the full blood test. The full blood test we do once a month. Okay, usually we do the first day you admitted with us and the last day, so that we compare, we explain to them which part you are not okay, which part you are okay, and which food you need to take. Usually we do like that to compare. Is it okay, Mr. James?
Okay, based on your statistic, I mean, among all the statistics you are given, I mean, normally for patient, in what kind of, until go through how many % of the treatment you can achieve a nominal level of the cancer?
Nominal. Okay, I cannot say simply 100%. Okay, so usually we can say like 60 to 70. So it depends on the body itself. Some of the patient last time we do have like 50%, they are okay. Some of the patient last time we have 40%, they are okay. I'm not saying that simply okay, like you can run already. No, it just say like you have the energy. You have the energy, you can counter, and the inflammation test also will be decreased. So that's how we monitor our patients. That's how we see you have improvement or not. That's how we do. Okay, Mr. James?
Okay. In related to this the cancer treatment, can I say this the so-called progressively long-term treatment for patient?
Yes. Okay. For me, it's a long-term treatment. Yeah, correct. Usually, I didn't stop my patient going for chemo, radiations, or you can go to do. But after you finish the cycle of the treatments, you can come back to us to to recover. To recover the side effect of the treatment. Usually, we focus more on the cells. So after you do, that's why I said radiation therapy and chemo, they are killing the cell. So if let's say you come to us, we are repairing. That means you got hole, and then we just like patch it to become one cell. So that's why I said here we are not we are not simply saying, oh, you doing this treatment, you sure confirmly your cancer cell is gone. No, we just help to your your cell's body become healthier. It's not that this is cancer cell, we like remove. No, we just simply patch the cells so that so that the cancer cell is slowly going out. That's how we do lah. That's how we do. So most of the patients here, they are coming to prevent. Usually we having a stage 1 until stage 3. We very rare to accept stage 4 because it's very dangerous, because stage 4, you know, is the last stage. So if anything happen, it's very dangerous. So usually we focus more on stage 1 until 3. We do have stage 4 before, but again, I didn't simply promise them that they have a good life after that. No, I just simply, maybe you can be better after this, but not sure, not confirmed. But stage 1 until stage 3, we can say like confirm. We can say confirm because they are in the early stage. We consider as early stage. So if let's say they follow our instruction, our advice, maybe they can have a good life after that. Okay, Mr. James?
Okay, good. Thank you very much.
All right, thank you so much, Mr. James. So any other questions? So anyone had this questions? Shirin?
Well, come back again, doctor. One more question.
Yeah. What is that?
Okay. I mean, you're referring to the cancer. Cancer referring to all types of cancer
Yeah.
in the organ, all type of cancer, right? I have a friend whereby there is a guy, is a man, almost 60 years old.
Okay.
He is being diagnosed with the so-called prostate cancer.
Prostate cancer. Okay.
Yeah, prostate cancer, but have not been go through any demon, but just using clinical drug. But I think this may be useful to him, right?
Yeah.
think
What
so?
stage? What stage are him?
I think would be 2 or 3.
Oh, that would be good because last time we do have prostate cancer before. I cannot say is I have to say the inflammation is reduced last time, if I don't remember. Yes, the inflammation is reduced last time, and the bowel movement also improved, and it take about a long time also, about 2 to 3 months to recover. It still have the cancer cell, but it reduced reduce the pain, we can say. So if let's say you want to bring your friends, or most welcome to come our side, and please bring your blood report so that I can know which part you are not okay. Okay.
Okay, good.
All right, sure. Okay, any other questions, anyone? Okay, so if let's say no more questions, maybe I can pass to Miss Shirin, our MC today.
Okay, thank you, Dr. Fida, for very informative sharing.
Right.
Okay. So we'll just continue to the next session. We just invite Madam E